We have performed the largest meta-analysis ever done in this subgroup of called superficial bladder tumors that are high grade. And high grade means that patients having this disease that it's not invasive, so it's indolent apparently disease. Some of those recur, around 40% recur, meaning that they develop subsequent tumors even after the TURBT, the resection of the tumor giving BCG. But the most important thing is that 20-25% progress and develop muscle invasive or can develop metastatic disease. The important thing is to identify clinical prognostic factors to design appropriate therapeutic strategies to prevent this progression and moving to the metastatic disease or muscle invasive disease. What we have found is that patients having high-grade tumors, those who have what we call invasion in the deep layers of the lamina propria, not in the muscle, not yet, but very close to the muscle of the bladder wall, those are patients who can progress and recur in a more frequent or more short time and more frequent incidents. Also patients having lymphovascular invasion and also patients not receiving BCG. So BCG is a therapeutic tool given intravesically. This is a medication that in fact is like a vaccine that help to prevent the recurrence and the progression of these high-grade T1 tumors. Obviously, those are prognostic factors. We are working more on that, looking for more specific predictors of recurrence and progression, like the genomic or epigenomic markers that can help us to define which patients we need to move to cystectomy instead of still keeping treatments that are conservative. For bladder cancer doctors, whenever you have a patient having a high-grade superficial or T1 tumor, you need to keep in mind that this can be an aggressive disease, so this needs to be managed by specialized doctors, recognizing the clinical and pathologic features that predict a potential progression or recurrence of these tumors, and then to identify this type of prognostic factors and to act in a therapeutic manner that can prevent all this progression and recurrence. At some point, we are enabled, so still we are working on identify those patients that an early cystectomy can prevent this progression, recurrence, and even die because of the disease. So there is a lot of work to be done, and we are obviously working in the lab and trying to find these signatures predicting this poor outcome. In a few words, if you have a patient obviously with a high-grade tumor, sent to a big institution where they have expertise on managing this type of tumors, doing a good TUR, giving the adequate dose of BCG. Maintenance BCG is also helpful in these patients, and adequate follow-up is needed.